A few years ago, I was in the ER and I was taking care of a very bright 16-year-old boy named Jordan. He had no medical history, but his mom was concerned about his mental health. And in the ER, we ended up diagnosing him with severe depression. But it was a few days into his stay in the ER before I saw him, because there were no beds available in the entire city. And so he was held in limbo, waiting in our ER just to get the care that he desperately needed. And on one of those days, he found me in the hallway, asked me to come talk to him, and he looked at me with the most earnest look in his eyes and said, "I feel helpless." And I looked back at him, really wanting to say something much more hopeful, but all I could say was, "So do I." It was honest because I knew there was very little in my direct control. But then I thought about it, and I realized there was something I could do. It was bold, and I decided to break the policy of the emergency department and allow Jordan to listen to his choice of music in the room. I know it sounds like something so simple, but the effect that it had on Jordan, myself, and our entire team that day was profound. We learned that he had been playing guitar and piano since the age of 8, and he was a lead singer for a band. For Jordan, music created happiness, and by letting him press play, we offered him a dose of therapy beyond the chaos. In the ER, we're often exposed to the medically vulnerable, but we also see the deeper social issues affecting our community. We are witness to the raw elements of poverty, violence, abuse, drugs, mental health issues. And our natural instinct is to sometimes turn away, pretend they don't exist, but we know they're there. We can feel it in the ether. And over the years, I've actually come to open my eyes wide and run towards these complex mental health issues, not because it's easy, but because I see how much they color the patient experience and the provider experience. In fact, I think they're at the core of every human experience. And I can't help but wonder, maybe we all need a little bit more music. I've thought a lot about Jordan since that shift, specifically how he connected to the songs. The music seemed to do more than just buy time until he got the right bed, but it exposed this dormant happiness. And it made me think about my own passions and hobbies, and I realized that they nourish my soul in a very similar way. And I realized that they provide a platform for me to connect with other people, almost like an antidote to loneliness. And I realized it's that connection that's at the core of our human fulfillment. And that led me to learn about a practice that's common in the UK and Canada and Australia that's focused on this philosophy called social prescription. Social prescription is a strategy, a treatment strategy that seeks to improve our health and our well-being by linking us back to our passions, almost like a prescription pad for anything in the arts or anything in nature. So think about some activity you love to do. Maybe it's singing, playing guitar, basketball, hiking, cooking. And imagine if someone in healthcare literally prescribed that activity for you. I know for me, if someone wrote down weekly dose of dance, I would be elated, not just because of the activity, but because I would be able to meet people who share the same passion. Now suppose there's a patient looking to reduce their cholesterol numbers. Their individual prescription might include a daily walk with a neighbor and a healthy cooking class. So you can see that these products of social prescription are actually quite simple. So simple that when I first learned about it, I thought this is too basic. We're already participating in these activities. But the thing is, we're not. They're the activities we wish we were doing if we had more time. Because in today's busy and booked culture, we spend our time filling the white spaces of our calendar with obligations that leave us feeling drained. We also forgo our human need for companionship, for socialization. We think all of these activities are optional or maybe even selfish. But I challenge that it's these very things that are the basic requirements of healthy human health. And the more we participate, the more we're aware of this need, the better we're going to feel and the healthier we can actually become. And a healthy, vibrant society is absolutely something that we need right now. Alarmingly, mental health challenges are one of the most leading indicators of poor life outcomes amongst young people. In 2019, nearly 4 million adolescents between the ages of 12 and 17 had at least one major depressive episode. That's 15% of that group. And currently, 4 out of 10 adults in the US suffer from symptoms of anxiety or depression. But regardless of these numbers, and in spite of these numbers, many of us choose to look the other way or pretend mental health is a buzzword that's overplayed, or a disease affecting only those kinds of people. But those people are these people in this room, in our families. And it's high time that we bridge this divide, bridge the gap in our knowledge and understanding so that we can reclaim healthy mental health with simple solutions. It's time that we stop treating mental health as a disease and start integrating it into our solutions. I believe each of us has the power to change the status quo and integrate social prescriptions into our own lives. The question is it going to make a difference? Well, let's look at the data. What we know is that loneliness and social isolation are major risk factors for depression. In 2010, there was a study that took over 300,000 elderly individuals and found that loneliness presented as great of a mortality risk as smoking 15 cigarettes a day. Here's the good news. Simple, very simple activities like choir singing, expressive writing, drawing art, even group drumming reduced mental distress and at the same time improved individual and group well-being. The data also shows us that people tend to adhere to the activities of social prescription because of how enjoyable they are. It's what they naturally like. And we experience a surge in our natural endorphins. Specifically, when we connect with each other, we see a spike in oxytocin, which is our love hormone or hug hormone, and a rise in dopamine, which is our neurotransmitter of joy and pleasure. Social prescription is also linked with behavioral activation, which means that the more regularly and consistently we participate in activities that are positive for ourselves, the higher our self-esteem and the higher our independence. So think of that person in your life who may be spending too much of their time alone, and suppose that just one day you ask them to take a walk with you. That single ask has the ability to transform their lives, has the ability to improve their quality of life, because you're building that bridge of connection and helping eliminate loneliness. In fact, you may help them rediscover their own music. Now, this is great on an individual level, but I think that we can do more with social prescription. I think we can use the power of it to support our students in schools and help mitigate the rise of teen depression and anxiety. We know that depression compromises our ability to set goals and to form relationships. And we know that schools are the first line of defense for so many kids. But if we can teach these students and equip them with a simple tool to help manage their mental distress at a relatively early age, we can improve and impact their life in the long run. So what I challenge and what I propose is that we can have a navigator, almost like an emotional coach, present in every school, so that students have access to this person the same way they have access to math and reading help. The navigator is someone who's emotionally invested in you, in your success as a student, so that no matter what obstacle comes up, there is a solution. The navigator works with every student to come up with a strategy, almost like an SOS plan. So whether there's an obstacle at home or at school, whether you fail a grade, fail a test, don't make the basketball team, or get made fun of on social media, you have an algorithm in place to help you navigate that. Because the navigator knows that the most important question to ask these students is not what's the matter with you, it's what matters most to you. The navigator understands that having depression and anxiety isn't as big of a deal as having empowering and innovative solutions. I do believe that we can make this a reality, having a navigator at every school. But what you and I can do today is start serving as navigators for ourselves and for each other. It's time for us to reimagine a world where we can take charge of our mental health in a healthy way, where we create a space of belonging so that all of us, like Jordan, can hear our own music regardless of the noise. So gather that group of friends together, form a book club, sign up for the art class, the dance class, wipe off the dust from the basketball, the paintbrushes, and the camera. And while you're at it, strike up a conversation with your neighbor. Social prescription may sound like too simple of a solution, but the most beautiful part is that we don't need a prescription pad at all. We just need to hit play. Thank you.